As Dr. Chitty can tell you, my husband was very tenacious when he got an idea, and I guess that's what made him a good scientist. The last time Tom and I had dinner with Kim and Stephen, Tom goes, "You're going to be famous from this. I promise you, you're going to be famous. You're going to get awards." And he would just grin and kind of laugh at Tom. My husband was a pretty big joker.
I come in every day because I love the intensive care unit. There's less regard for what the job is and more regard for just getting it done and getting the patients better.
Dr. Chitty, he walks in the unit very confident in what he knows, but yet also humble. He's a phenomenal teacher. He also responds with evidence-based practice, which is very important in patient outcomes.
It's not hard for him to inspire people and motivate people. And I think people really pick up on that energy, and I think that that makes everyone around him eager to learn.
I feel like I can always go to Dr. Chitty to question without ever looking down upon. If anything, that's what he encourages.
He's trained us well, and he trusts us, and he trusts our judgment.
We all have to have the same goal in mind, is to try to make the patients better. We routinely do a multidisciplinary rounds where we have everybody involved that touches each patient each day. Ideas are shared and we come up with a collective plan for that patient for that day. I think everybody has ownership in how those patients turn out. In the early days of COVID, nobody really knew exactly what we were dealing with, how contagious it was, and how to treat it. The patients became very, very sick very, very fast and required a lot of life support.
When Delta was hitting this community, it hit here extremely hard. Everybody was just crashing. We had all these people that were going down, and I just called him and I said, "Hey," on a Sunday, he wasn't working, "We need you." "All right, I'll be there in 10 minutes. And that man worked 28 days straight.
COVID became a big problem in our community and a big problem in our hospital. Honestly, multiple patients were passing away because there was limited treatments beyond just life support.
We were trying also our own novel approaches, trying to have better outcomes for these patients in a situation that you felt like there was no chance of survival.
A lot of what we wind up doing in the intensive care unit is cutting edge. And so using braking technology when we know about it, especially when we think it's safe, that's a common theme in the intensive care unit.
If you remember through this time, we weren't able to have families bedside. I think that was one of our biggest hurdles, was keeping communication open. When we started introducing any new novel treatments, just to see that glimmer of hope and thinking, okay, we can do this. Without faith and hope, we don't make it through, because it starts from the inside out.
My husband was a scientist. He had been at CDC for 20 years and was an immunologist and a virologist looking for cures for viruses and other diseases. He researched AIDS for 20 years, and that's sort of a virologist, immunologist dream, because it affects the immune system. We had retired at St. Simon's, and I was still teaching. So the first time I heard of Dr. Chitty was when I taught his son, Hayes, Georgia history at Lynn Middle School. After that, my husband was looking for a pulmonologist at the hospital because he'd started a think tank about COVID with scientists all over the world.
So Dr. Hodge called when I was in the intensive care unit one day, a pretty typical bad day of taking care of COVID patients when the call came through. He was very persuasive and obviously very intelligent, so it was definitely worth listening to him about a new device called the Seraph filter, to just consider it to see if we were the right place for it. And as it turned out, we were.
The Seraph 100 was evaluated as part of a DARPA project. Much like dialysis will remove waste from the body, in the USA, Seraph received emergency use authorization to treat COVID-19 by removing the virus that causes it. It has also been reported to remove bacteria and fungi. The patient's blood is filtered through the Seraph outside the body. Seraph traps the virus, and the purified blood is put back into the body.
We were able to do a little bit of research and see that the filter had been used in Europe quite a bit. Very excellent safety profile. We felt like it may be a good idea for our community, really just hoping that it would save some lives.
Within 24 hours, Dr. Chitty had the whole clinical team on the phone with me. C-suite, nephrology, pharmacy, critical care, nursing, all on our very first call.
There was very little experience in the United States, so we had to really pioneer the way it was going to be delivered.
Within 7 days, I was up here showing them how to hook up the device. And that first patient that we treated, I remember looking at Dr. Chitty and saying, it might not work. It might be too late for her. The disease process might be too far gone. And he said, I have to try. She walked out of the hospital.
That was a sad year for us. We found out that my granddaughter had cancer. My husband tried to find all kinds of ways to help her, and then he got COVID. He had been taking medicine for a type of cancer called mantle cell cancer, and his immune system was just gone. Too much to even put him on the filter that he worked so hard to get into the hospital. Dr. Chitty helped Tom through the last part of his life, and I can't think of anybody else Tom would rather have been with. The day before Tom died, he did the think tank from the hospital with all these scientists around the world, pulled Dr. Chitty into it, made him talk to him for a while. Steve called me and said, I'm going to let Tom come home.
He was on a video call with the international community looking for the next great medicine or device to treat COVID. He was constantly looking for something that could help. And even though he was showing signs of improvement, he had a dramatic turn for the worse.
He said, Kathy, you need to come to the hospital. Everything we've done didn't work. And then Tom threw a clot in the middle of the night. And then Izzy died 12 hours later.
Really, it had to be a pretty brave thing for him to just out of the blue call a physician that was working in an intensive care unit for COVID. It had a massive impact. Now multiple other hospitals are using it, and it's really just taken off.
Dr. Chitty is the tip of the spear. He has treated more patients than any other hospital in the United States at this point. And now he is very involved with hospitals around the world discussing how to best treat patients using this device.
There's been 2 trials delivered, and we were able to enroll the majority of the patients that are in that trial, with that data starting to be published now, which is very favorable for the filter, which has led to the ongoing trial where the same Seraph filter will be used in septic shock patients, irregardless of whether they have COVID or not.
Here, I think it's really exciting for everyone to see how it's done and know that we're all going to be a part of something bigger that could really end up helping people.
The impact that Seraph had on the patients, the ICU, was it gave us hope. Hope for the families in an extremely hopeless situation.
the two of them together, they were so excited about saving lives, and that's what they wanted to do.
The fact that Tom Hodge was able to introduce this to Dr. Chitty, and the reaction was, I need something else. And he jumped on it and made it happen.
If I could see Dr. Hodge again, I would tell him exactly what he told me was going to happen is exactly what happened. He would love to say, I told you so. He was that type of person, and you would just have to accept that at this point.